Etaya TV. Oborabu Wagusi.
Mwanchu muligereria Etaya TV biamono ase ko mulemereria twachira somo timoko moke asengencho kwarigania mageni itu ase studio yugete mapema kigima andi niko tukona lenga mbia mono egera turachikuligereria mangana alinge tobo cheno inyora kera litukoria Jumanne niko tuchitwa kwanira igoro ya mangana alingete obo cheno asoko nyora abanyagitari korwase chi field mbali korwase chi specialist ao egere twanyara ko batu kuligereria ngana kitokwerenda byake bocheno akiri tukoyerero mwancho muligereria nigonga netie rero turara ligereria emeremo y'abanyagitari baito bagokora bali bakoruka abanyagitari chinas turachikoye manya asenjera ya bene torore emeremo yabo bagokora torore mechando bagwetera torore the achievement usali bayikeranirie naende torore nga what is the way forward na kibagwaneta ko ba empowered na kibagwaneta ko bagosirwa munenjera yo kubeka emeremo yabo ebe emiya naende mekeranu was effective service delivery ekoroko genda se tinyagitari gona semambia bono nganchere tumwariganie munyagitari tasemambia bono atajitambulisha kwa majina abatabina kyakorokwa egerna ndeto munyo chako morobolio asemambia bono asensemo ya Facebook no tole kabisa YouTube no tole Etaya TV asensemo ya Facebook no tole Etaya TV link no tobegete galia na bako yeshare egera banta bange banyara ko babagutubwate semambia bono SMS number botambe mere ase TV yao na ndinga ndra goko inyuria egera nyoko bwate ibolio ko bwate feedback ko bwate kendi yonsyo commenta abugo to ikere mo ase yemo teto mwarigani munyagitari to ase mambia bono. Good morning doctor.
Good morning, how are you?
I'm fine, and you?
Pleasure to be here.
Pleasure to meet you too, and thanks for keeping time.
Yeah.
Unajua umekeep time kama walimu.
I'm very punctual, and the success of life, you must manage time. You must manage jinsa na chio ekerengo ekogendrugima.
Yeah. You got the more ko interrupt jinsa chiago, it is done.
Yeah. Kuna kwalinda jinsa chiao ni bintu byao bikoba buya.
Kabisa. Karibu sana na Etaya daktari tetokwa ni mwanchu muligereria omotevi na kyukorokwa ngaikwa rule tumanye guisaransa kogendra ukwana ninkwane yaitasimambia bono. Karibu sana.
Kuna mwaigwa sarateba amalietane nkuru kuharizone omwega Mariga injeno monchali nkorwa Kisi County kure ward ya Murenda. Igongo kolega siana aria Kisi Teaching and Referral Hospital una omuwosi wesindani.
Okay.
Esindani murero ndwanje wocha surgery go sokore ndu theater nichengo bekeriogo omanya ko barwa. Onye to kumubara turusyo mwana na mubeke sindani yo mugongo. Uruzi w'umwana onye no monto ukobaru womutu namubeke sindani yo korara obaru umutu onye nebigoti dese onye nebigoti esindani yo korara arozi webigoti
and by the doctor ngo kwanira turega abungo chituri to understanding ngaki even the process how do you prepare monto yega ngaki baka na ara bata abokera does it really happen osegara abokire iyo geri ngo chiriria mo chanda at some point ayungu ikatororo but meanwhile karibu sana daktari Harrison omwega Mariga igakoro bonchari no mwana ito mugusi kabisa agena goroko kwa nonye neton naboko buganga tali mugusi but no mugusi aro kwandubya asemambia bono. Daktari, the role of nurses recently gantu abachingira ntu araba inyora emirimo mogokora asinyagitari abakora limokorwa ase facility cyobo cheno tukabachengera and togendrete ko bachengira. We want to understand who is a nurse ngasikie yago kora. Let us begin it from there.
Thank you. What I forgot early, I didn't say I'm a family man.
Okay.
I'm a family man. I have 2 boys, 2 girls. Yes.
Ibanga is a husband.
Ninda banto. Ninda people. Na bantabo niko gerete komanya na barobo.
Okay.
Umuntu nakuru kwa rusira nyati chongeri. Kuru machoge.
Machoge? Machoge tense to machoge chacho sura.
Machoge. Bona kalongo chako na chikura cha chubo gaba na 2032 igona monguru chikura chinde umachoge. sinyomete kurwa.
I like that.
Yeah.
That's very nice.
Bono tuirane enganga yandetaga divining a nurse. A nurse is a golden person.
Okay.
A nurse is an humble person. The profession of being a nurse is a calling.
Yeah.
It's a calling. Okorangiriwa. Egento kiriyo gotakokora n'ugwanja kwao. Kari egento kiriyo gobetererigwa. Omuntu kuruma binyomba. Wacha kushurikira barwaire. Wati go mwana okarwarete. Wacha kurwari abana babandi.
Yes.
Marange abantu mbamanyeti a nurse ningi.
Yes, we don't.
Maybe we divine a nurse or give you a history about nursing.
Yes, please go ahead.
Nursing started long time ago during World War II. Our modest nurse, Florence Nightingale, is our modest nurse. When we read the history, like during World War II, Florence Nightingale volunteered to train nurses. He was a manager. He tried to train nurses so that the soldiers who were in charge during World War II to wash the wounds.
Orontage tumungo riorenkari understanding a nurse montoki. Egera tuba kwanero erwe to biye ke usige to biya sige ko bacha nonde gaiga. Egera ba understand kabisa nga chinga kijisegi yense yakabere chisegi cyakabere cyense. Yes.
Bono ete kusinega komura kino tuyiburiga. Omungo riorenka. Egasi yoko ruwari abarwaire eyachagete kare sana enga kijise ya kabere 1853 pasomo zbati okorokwa Florence Nightingale may her soul rest in peace. Umungino yiga bwate nkoro indabu diri abana jesi ba umire bari kurwana era gatoko ngakarosiema abasoja bari ba umire basibi uwa maote ubasibia maote abantu bachakorra the need of nursing in modest nursing. Then it started how igachaka iko na buibuire iko umungino yine buibuire iko arare buja.
Yes.
Nero gerete bono munoriga mbago isaranze teiga ne nasi bwadete umanyete maramanga abantu mumanyeti asoko chaka obotongi enasi noere we call it conception dimate na kwega umuntu bikagusi enasi noere
otongi na bwo
kokoro musigo dirogo je clinic enasi noere okorora marakane ritangani inze chubiki 20 ugo janando korabare mutinyo yomo sindani rao kubete ya tetanasi okwaji ndedere jinde chikuru fera salveti wanya kunywa chiko konye karoja kwenye umwana tatu waro bwate jisfek ine nasi kokora wacha baka marakane enga kiri ugo cha kinshule jichonsi nye umunasi ugo bia pressure obwate stete kobu ugo kinkori wak okonyera kubwate pressure kote ya Sara, pressure ya iriguru. Orengeri nga kya konye nize. Hotel mu nyatari monene. Emo gotor ko benegitari moke. Lakini tunabani tabane into kumanya mangana to manya ko. It is that was the problem to the primary care provider. But ideally into abake. Patenyo ni wonjurwa jeda tebanga ki enasi nero monto monene munase utake monto monene nero kumanya mechando. Oteba. Wawe clinic wacha kuibora ariyo kuja kuibora nanu munasyo konyora umunasyo kubanguza marama ange onye to watengoro yokorea igasi bunazi na bugutika kore mariyo kuibora abange bagusumbua especially the first time ladies bagusumbua bamanyeti to robore mari burubunge abande baguruzi cyanga abande batabana tibiro mugacha tingo irorera wamuremere kwamo banguza utera amache ogenda none icho enene kwamo banguza nenkoreria ine igasi nasi umwana uriyo kwabanguza umwana uriyo yana kwako kanere ko mate mama mbuya you are an important person wabo omupete sindani entangani within 24 hours OPV okendanga ira naenga nanda kutaziki zuguyigisi nando katabinga girende sadu kwa nyoro mwana oyo karatumoka kirende tonyora mwana onde egero mwana oyo ndakinde nanda ziki zuguyigisi nando kwera ne clinic nando kwa nyoro monazi obeto omwana gisindani chibwe kisita chibwe ikomi chibwe 14 ando ngobete kisindani kyonsi okora ikomano roje ngano monasi conception antinato atibati no monasi orabo
ebintu byonsi biri
byonsi na abande bana bagoikeranga bono omwana gusara ire bobe goso omwana onyorurugocha nande nazi yatebye da doctor ngaki ngendo je sara tari kosuka busha nari kire pato kira bweje tari kosuka busha teka tumuire tieta tokonyo omwana tokonye nangina ndiri ko chiabe barati metwa konyo mongina omwana ogenda goso mongina ogenda omwana otoka itari nasi nasi tari yere gokora 20 yani tari yere yakera wasira nero teranga ya tokonye sara bwango naro renge hati bidije fito hati dio omwana tiko genda buya ko ikabona tieta nando kwanyore nasi nandi noere kwanyore doki surgeon kwanyore nasi noere ari kurunge scrap nasi idana nasi kwanyore nasi anesthetist abona none nani beke ryogo arutsi umwana nani nasi irabo ikuisa ko rabono kira azini nasi nasi noere
by the way kwa kibekire bya daktari yani in every journey it has to pass through the
including the sitting president, every person, including the superpower America, Trump, has to on us. So on us is as a rep.
Congratulations for the good work you're doing. We katoro totabinga na kibago chabono na kiba necessity specification chirop na whatever I know we see that and into what another nurse and on another different field. But before that, daktari, how has the nursing profession changed over the years? When you think more chakir and your mother, your mother may she rest in peace, your chagetega it's not the same. So how does this profession nakia change over the years? Is it changing for the better or for the worst? If it is for the better, daktari, what are the profession has changed to better?
What I can say, it has changed for the better, but it's us people who are utilizing the services totally embraced. We have not embraced the nursing profession. When you go to the third world, they have embraced nursing. It's only in Africa, actually to be precise, in East Africa, we don't embrace nurses. Bona sama hosare omunasi oyo tabuga tibesa omunasi oyo tali impressed panto mbali korange gazi yo munasi oyo ningere we are not appreciated despite that we are proud of being nurses. The people we are giving these services, they are not embracing us as important people. Negazi yebo nazi onye tovuga chomo yobo konyakora na ndo chokora maramangi bona bono there is an anesthetic zozirire may his soul rest in peace Viringi who committed suicide. It's unfortunate. We have what called burnouts. We don't forget that. You know, you have left watikiro mwana unka urwarete kwachakora abana bande waikire gasi abere nyinge nande bone sotechi nande bone sotechi asekale.
So those are challenges.
Shortage, no appreciation, burnout everywhere. Omosaharo yo konyorwa. However it is, it does not come timely. Nurses have bills to pay. Aba nurse amba bwate chibi bagwakana inyumba agera abana bali school. Umusaro onyorirwe. Umwana ozali gwe school fees. Watiro yorwari tengo ndo kali gwe school fees. Abando kali koranya gitari. Makikuru enya gitari yo nyumba ri ko ruru rware. Kore gaso nenga bino rwati ga nyumba na kiaka ga enderere. Burnouts everywhere. Maybe sometimes you get your senior, he's harassing you here and there, burnout, inaongeza. So like when we talk about depression, you are not able to consume all of the pressures. So which leads Avande to commit suicide. They go to alcohol, they go to addiction, they abuse drugs. We are also human beings. Nurses are human beings.
Despite those challenges, yourself, you're looking good, Doctor. You even don't seem you have any pressure.
No, we smile to spell. We smile to spell the pressure.
How do you manage those pressures? Because you are there. You are there. No more emergency. You are there to make sure life. How do you balance the pressures of work and personal feelings?
Before I speak about that, let me remember what I've said. Not what I've not said. We have what we call strike. And we've tuigwana nini ngakira no monasi. No monasi. Kira no monasi. Ogo tunagita ria accident tokega use moroche strike inasi no ebaga nayo yore angegokwa uyo tarakwa uyo takire gosono pero kubagana. Strike is very important. It's not an answer that. Obanka bystanders for granulars for normal saline. Overgrade according to yellow, green, and yellow, red, green, and black. To each one has a balance. In a teva igana na irora dikale na teva nga egasi no kwiro kora ekero bwato omoyo boko kolegasi yeye abokonyoro mo. However, distraction disturbs this. When you get distracted, all work makes chakada adult boy. But when this Jack adult boy is motivated, it withers down. It's not easy to balance, but it needs a heart. What
do you think it should be done? And this is a must done because you are not there by accident. Because of your passion, because to get something, you have families. I'm going to introduce whether you're a family man with children, with people depend on you.
Yes. Who are proud of me. Who are proud of me.
Whatever 2032, God willing, you will come out.
I will go to an electoral seat.
Yes. So, what do you think should be done on this health sector to make it better? Because when I got also make a Daily Nation, teachers have issued strike notices. You give strike notices all the time, but we can't be giving notices of strike all the time and nothing is being done. So what should be done once and for all? So that the work can move smoothly.
Again, timezonete gusikia taringa banta baroche mbaroji chinazi mbaroche erorye nasi egento kere asibale no bwenje the leaders they're selfish. They're simply selfish. And we've agreed every part of life an art is there.
Every single process.
Every part of life an art is there. So the sitting president knows it has through an art. Our current governor passed through an art. So him implementing policies to motivate an art is easy. Actually, I realized it's only in Africa or in East Africa. We embrace nurses. Third world countries, European countries, say even in America, they embrace nurses.
Hold on there. Shortly, I'm cutting you short. Please, Mayunga, come on. Dr. Ribe Boronge, asinging Chilikarugune Taiwan, we don't get it. South Soka Boronge, and then South Union to Tagete. So, meanwhile, when Dr. Harrison, Omega, Mariga, Nigaro Monas, and I end Oliokubeta Sidane Grant. Kwenda mangana ya chitieta ochikobarwa egere kwarara byato kuibo rubulibo ko baroro igoba no manchubuli asema biabono nyokogende tukutubwatia tukwana the role of nurses in health sector ebe Kisii County, Nyamira County, ense ya Kenya ngimikiagara they are all professional nurses bakoligasi ya Burungi. The challenges you gotagoteba, they are being underpaid. Wanyama wagani chimesa they come late chikonyorwa arabu abantu they just take them, they're just nurses nurses. No, every life whatever enchera yobo mabwa mwanya bantu kureke kwerere kurkwarengerelinga you want to conceive, a nurse na part of your life. They are walking through the journey together with you. Like yako ratoko bachengera all the time. Bachengerwa the last month, lakini toka ndata ko bachengera because nto woisania oko bakerenga biyo. That's why we keep on celebrating them. No nyembone ta breakfast show, we are celebrating Dr. Harrison Mariga na abanda abangi. We are continuing celebrating them asiga singia bagokora. Daktari karibu sana. We continue.
Whatever other roles.
Yes.
Or specialties. We talked about triage.
Tutareka mungu kwa natwalenge emichandeli mugwetera
emichandeli tugwetera
ngitokora twerusi from those what our leaders are saying.
Our leaders are selfish.
Yes.
Abara ibaito ebeyanjete. Because imichandeli tolero mbajiroche.
Yes.
Onye no kuiborwa no nasi ya muiborete ya makonyeta kaiborwa. Ese clinic ni nasi ya mwete sindani.
Abana babo they pass through.
They pass through them. And when it's like now, you can quote COVID-19. COVID-19 nurses did a marvelous job worldwide.
They haven't been paid up to now.
And you see now, we have UH nurses who have not been employed.
Yes.
We have UH now not employed.
There are those who have not been promoted. And
when COVID-19 came, it is not discriminate. Every person was equal. Yeah. You know, at times I realize like, let some things come and make us realize everybody is important. Every person was equal. Yeah, when COVID came, every person was equal. We lost even a doctor during COVID-19. He didn't have blood. We lost even a nurse from Homa Bay here who was a nurse who was pregnant. She was not able to get adequate care from fellow nurses because one, resources are scarce. Two, pay is scarce. Human resource is not enough. Like, we don't have enough nurses. Yeah. One of the causes of burnout on nurses, we are not enough.
You are not enough, but
WHO ratio is 1 to 10. But you go to one of our countrywide, you get a nurse managing up to 70 patients. The ratio is 1 to 10.
Nasi mmoja anafaa kushughulikia wagonjwa
10 patients.
But in this case wanashughulikia wagonjwa mpaka 70.
Yes. So giving adequate care for such patients is a problem. Actually, what I can tell you for a fact.
Yes.
It's only in Africa patients die. Outside Africa or in the USA or UK or Australia, we have relatives and friends who work there. People don't just die. It's a process to die. It's a process to die. It's a process. So when we're talking about living up to 70 years, some people are living over 100 years because they don't just die.
What should we do? What should the government do? Because an action has to be done.
One, employ more nurses. Two, over-condition the environment of these nurses. Three, respect nurses. Three, embrace nurses. Three, give nurses managerial posts because nurses are managers. Like now I can quote the issue of the Kenyatta Teaching and Referral Hospital. The CEO is a nurse. Yeah. Kenyatta Teaching and Referral Hospital is doing very well. So it has been proven like nurses are good managers.
So you are equal to the task.
We're equal to the task. You asked about my smartness.
Yes.
I was born a leader. Primary I was a head boy. High school, I was a head boy. During my campus years, actually, I was selected or nominated SLC chairman in absentia. I'd gone to Nairobi to see my family. They said, that man who made us eat chicken is going to be our chairman. And I was elected in an absentia. I was in Nairobi and someone called me, Mariga, we have elected you as SLC chairman. I was elected in absentia. Yeah.
No.
You know the kubasera talibobe lakini bagataba ngaki abantu twakorere buya ore asata banyuna bonyuna barabukombobe utari kubasera you simply appreciating them. So the issue of smartness, I can simply say me have grown out with it. I'm a born again Christian. I go to church. Actually I'm an SDA guy. My dad is now retired Pastor Mariga. So as we are brought up in a family like we wear suits. hii maneno ya kuvaa kwenye kupeka kisuti jirege ndo nakinire jirege ndo narete na wangi nyo itari mu mwarimu aborete atebete abone ko aki onye tukia otekingira une ya Mariga ikotungiretie tuki. I was reference boy in school.
Okay.
So smartness is a weakness to me. So I wear my suit, I go to theater, I change to scraps, then I wear my suit. It's part of my attire.
All right. Man pepe sagero nkobolia livolia twali kwenda se profession by the ya abu samangana yoko beta chisindai. Specialities. Ngwenda toro sagera I will ask you a question na ndi kwa narode watogiri sana munyagitari medisemo kama nyaine usaka wakiri na kwa na studio but rende nasoma hiyo jimbe yako hivi sasa. Kuri narote betenga what are some of the specialized fields within nursing and what do they entail?
Abantu bamintaba kuziba minto. Enda abateye umunasi n'umuntu maana. None karo to ina gitari yawe nursing home beko munasi. Ndobwate clinical officer, ndobwate nurse, ndobwate doctor. As a nursing home setup, a nursing core departments. But the clinical officer core department chose. Like in MCH, a clinical officer cannot work there. He does not know how to inject those vaccinations. But a nurse works across board. Actually, in third world, nurses are doing CS. Cesarean section. Cesarean section is the cheapest to do. In third world countries, either Australia or which other countries this? I think I know 2 countries. They allow nurses to do CS. So these other surgeries like general surgery, like obstetrician, that's not specialty now on doctors. But we have up to 6 specialties in nurses. We have anesthesia where I am a nurse anesthetist.
Yes.
We have oncology nurses. We have renal nurses. We have ENT nurses.
Okay.
Renal nurses, these are the people who manage dialysis. Let me now tell you, Sarah, when you take your patient to hemodialysis, the person who manages your patient is a nurse.
Oh, hallelujah. Yes, amen.
Ora mantu ba mintombe gitoma manye umunasi no muntu maana ekoro muntu akomohorera akekerera kiriogi umuntu bwengenjo asamangana yobo chenu no munasi ekoro konyo no muntu akorwa no munasi mukiama to igoro akekerere onye kobwate keboko mubutori tapore kurwa ni nasi uno muntu maana kogota customer care no munasi uraria kogota botuko ekoro kwa duty room omunasi na restaurant taria akere doctor inchu emergency ajira nasa nasti tsinga yore inchuga atabenga accident ya biro gembo ambulance minyoke no munasi okokore ebintu ebyo yet kabuhati call allowance yo wakakisimi echo.
No, they should have.
So nurse patient, let people not call us just nurses. We are not just nurses. We are important.
How do you bargain for your allowances? Because it should be there.
We have what we call CPA, which is bargain on behalf of our leaders.
Yes.
But as I've said,
which is your body, by the way?
KUNAN.
Okay.
KUNAN. Yeah. W. We don't have goodwill from the government. There's no goodwill, as I've said.
I don't think there is no goodwill.
And there's a misconception. I think I've remembered. That is what I think even you could be thinking on the same boat, like a clinician. When someone telling you that I want to do, I didn't see a clinician. I want to tell you for a fact, and you can write it down. Interpretation definition of a clinician is a nurse, a doctor. There are 3 people and a clinical officer.
Clinical officer.
When someone tells you go see a clinician, you see a nurse, a clinical officer, and a doctor. And these are the 3 people who can do a P3. No just amabazi. Ibintu manyeti, abantu baminto manyeti. A nurse who could create P3 again a contest again for the P3. A clinical officer can write, a doctor can write. So the clinician it consists 3 cadres: a nurse, a clinical officer, and a doctor. Yeah,
we did.
But all along, when you talk about a clinician, people are just believing like a clinical officer. The word clinician under the radio definition, even you can do even Google. It's 3 cadres.
Yes.
Yeah. Clinical officer, a nurse, and a doctor. And by the way, another thing again, nurses have advanced much. You know, we are what we call a scheme service. A nurse does a degree. She specializes
A nurse.
Yeah.
That's
you do a degree, you specialize in anesthesia, you specialize in oncology, you specialize in nano. You can still progress and do a PhD. Like now in Gizi County, we have a doctor, a nurse, Dr. Julie.
All right. Dr. Julie Nyamao.
Yes, that is a nurse. She has done PhD. She's a doctor in nursing. She's a nurse. She's a doctor in nursing. We have even professors in care. So they issue this message like a nurse is just a nurse. It's not just a nurse. We are important people.
Okay.
We are people who have gone to class. People have gone to class.
So you say a nurse does a degree and
do masters.
For how many years this degree?
You know, if you do straight, you can do for 4 years. Come with the PSI in nursing. Then do a PhD and do contestation and become a doctor in nursing. It is there.
Right. Yamona sana daktari. Thank you.
Even professors.
That's why we want to understand your roles. I'm sure going forward ameelewa vizuri. Umeelewa vizuri ekasi ya ino nurses. Una mobwate specialities. Unajua tabiri yao alafu nero ya oncology, nero ya reno, ICU. Wale watu wanachunga watu pale ndani, kazi nzuri sana.
Naona kwa ngagirete nje na simetinga kinga kwa rusena amba wantega haya. Ikawabwa omete na bogo icho kwa nega iga nyaro kwa kirwezi hivi. Obodunga ki wa yito kwa nanga kwa river. But I want to go on recording. You called me, you told me we was representing nurses.
Yes.
Give us more insights about nursing.
Yes.
Yeah, you convinced me. Yeah.
That's why you are here. Yamona sana. Nimata mabwata maboli ya mange no inchi nimbata mange ga wanato mirito karwaro che posta bagateba mbukuboli ya maboli ya manga about mangana nursing kabisa. Na tugenda tukwanere kasiyabo, their roles, their challenges, their achievements and what they think should be done for them banyore amazingira mayasi bagokorere kasiyabo. Tore marange nkora mabali. Na ndiko bintu moko gomera is very valid. Promotion, trainings,
salary, allowances, our CPA.
Your CPA.
They're legitimate.
They are legitimate.
Yes.
Lero mukirete ni kama vitu zenu ziliangaliwa vizuri. Naona wali mtokana.
Njara tole ndoto biringa nto ewe bintu tukanyitonya mbiri cyo jabune budget yego jago unayego jago somwe nyiga.
Yes.
Toje tusabe.
Mutanini. All right, that's very nice. Tetara some of the feedbacks daktari. Egera tumanya ko gendera busyo. Gancha kirmani pepe Sagero, you know him. Sagero no lyo mwana muziki. Omonene gusiyengima asamangana y'Chingero ende ngokora tuli nerega igase umurobere gw'Chingero Bunyangero. I want to say hi to mheshimiwa hii ilikuwa ya jana. Ametumia sana ananiambia Sara salimia daktari sana. Amenifurahisha kweli kweli. Oyoneke moda ekenyene. Anasema niko na swali moja. Iko mwanaume huwa anakataanga kuweka signature bibi zao wafanyiwe upasuaji. In that situation, huwa mnafanya aje kama nyinyi madaktari? Ilinkolilana litole abuno tochikogenda shortly. What if bibi ya daktari akilazwa hospitali, yeye anafanya kazi, anahitaji upasuaji, atamfanyia kama wengine au hiyo ni special case? Sagera hii tutajibu. Daktari oyione sindani hata muraina wako nyara. Hata vile muraina wako nyara kabisa. Tutajibu hiyo maswali yako Sagera. Sama beya agotebanga kebirigo ama tuko alero we have very careless nurses. Ekero bako rora abarwaire igo bako batebya mangana mabe. Want them bamanye. Agoteba there some nurses. Ntoko generalize some mabeya. Some mabeya maybe otwaje case asa gotebanga for example tabire kebirigo rugoro. Some nurses are very careless na ndeni go bakorora barwaire babatebya mangana mabe agotebanga tafadhali warn them. Does this happen?
Sarah, I can tell this inateba karega obo nasyo obo nukurangirwa nateba nukurangirwa nche ekaruna nengo mwana omoke igona menyete na makamoke nyumbo wate oburire bw'esukari oburire bw'esukari ekero gutwaleka tonda turi kubwena bwangu so nje nabwate nkoro you know nothing you are the what can I put it nayo gosemeria
asumuruiro oyo
omuntu uri disadvantage nayo gosemeria so I could see that good of my aunt
abandi
banyinyera nchena ariko bwata nari karatasi yenero natinya ninyorete mama wantenga ki mwana uyo okoboko kwao nchena bana ari gotinya nane jenda tebe na korete gasbaringo omurire na konyete abana kisare agaitera manyinga kibarongo agaitera manyinga inkabekera ini edo gitandara mwakera ngabekera ini amaja kunya kuminyoka ngwake ziminga tebe na jene nganchumo nkonye you know when there's PPH you shout for help so that process the husband came like the wife realized I was doing so well akaniambia huyu daktari ni mzuri do you know the Pokot guy brought for me a goat.
That's nice.
Brought for me a goat.
Well deserved.
I received a goat. You know what happened? I transferred that goat to Nairobi. My family was staying in Nairobi by then. I transferred the goat to Nairobi to eat with my family. So ega hasiye buno yago tabakebirego ekero abaruire bandi bagucinya gitari ndurugo cha kubayebereri lakini nabo tebigana ki ekero ko kori gasyo bwato moyo nabo ko ebereri omuntu for the sake of your outcome yao punanje tindiko kora buru tindiko ruari murwaire ngakwengoke ekero ngo konyo murere uri serious when I deal with a serious patient and he picks that's my happiness so it can be one or two cases like unajua kuna watu wamezaliwa kuna watu wengine wachi kupembeleza you know all these matters like who come for delivery amezaa kupembeleza na bwana tukua na maana amezaa unajua sisi tunapeana huduma sisi sio kupembeleza like now this lady amezaa kupembelezwa na bwana yake like now anataka tu at least mwambie baba no mu you know not all people can bring out that word baba no mu yore ga akigora magurumbe ke bicara ekero tukubike bicara tukupima ki mwana asukire
na kiasukire gocha
on that process umuntu ndia gusumbu mu sister nabo muntara agechigwa matenga wakande taramuhaka wakande mu subati igora maguru mara mingi bari koigora
yes marabo
so ize kunyara kana bairani ni litari mu sitaro mube no mongi no musumbuira mono ororira magose igora maguru mwana takwa
all right
I think na koirani
ira ne boronge sam mabayake yeto omanyire mayete dabara dadana Dina borera ubwango wagera toko konye
na nduru che twateba ndugwate bana nguti ratio 1 to 10 akobwata bakubande bane abande omutu asokire ategeta ko pime bwango ari ikenga kyora akonyori ayo tutageti oroje kana ebweka
oh I see. It's just
I convince you.
You've convinced me.
I have another thing. You were talking about consent. We have 3 instances. Like a non-African has come very serious. No talking. There's a provision like you don't have to sign consent to do surgery. You proceed and do surgery. If it's not talking, it's a non-African found on the road with an accident that's gone to the hospital who had tibia fibula fracture
that's okay.
For surgery. There's no need for
consent.
Yes, and if the husband has come to the hospital who has refused to sign consent because the wife is not talking, that's now a different scenario. That's the consent is there to give permission. Like in case of a complication, you don't have a legal implication like the one I saw in Aga Khan. How do you get 157 million? By the way, I would die minus touching 157 million. So you are saying someone to pay 157 million? I don't earn. I would never access 157 million till I die. So how do I pay that? Sometimes courts they are unfair. They are unfair. Yeah.
Right. You go wangasagera teba nikimo gukora onyero musubati ngukwa nale what happens onyero bwangire gusa
you know the rule of consent is if someone is above 18 years he or she has authority to sign there is no way the husband has authority to make a decision over someone over 18. Where a parent or a mother has powers is where of under 18.
Okay.
Yeah.
All right.
Let it be known. Abantu bantu tuwote bu maene. Yes. Omoga konya kabwato bo obogondi ko ruwo ya kabanda nyagitari. Eko mungu nako nyagitari. Ale to bogondi wa nyagitari.
Wanka.
Nandi to konya walire babwena. Omanyete? Ina ateba ya kana ringa baringo na yatu emboli. Nturi ko koraga stoye kwe. Ntu to ko koraga asuna turikire.
Murira bwene.
Omanyete eka ro koraga muriro nyagitari ko ko marento konyo. You are not able to handle a patient at home. You have brought the patient to the hospital. So we have two options.
Yeah.
You will try, we treat, God heals. Tomokonya bwene. In an unfortunate event that patient dies, you don't beat that. Many times people slap us in the hospital. That's unfortunate.
Mulifanyaje?
Nobody comes from, nobody's a sadist. I cannot wake up from morning to come and kill a patient. Ikonkuru hamna nacha iga ngoya ndandele ronga residential area MRI. Ndi go janja go ita ngo chankore gasi.
Right. Pia kwa kibikiri daktari ayantwale wechokomanya by the way. Kolo chokomanya P Sarah, I am Mary Nyabaro from Mitivo 1 SDA na ago kirikigi makorora maisano yunyanje temono. I thank God asimir mago kora mukwani gaki yaso itoro ya P mongina Mary Nyabaro.
Ante nago kwani ri.
Akaira wege kabisa amanye tende murubali bwa bachano ntubu atinso ni mono. Ni daktari ata igora magoro tubeke bichara na bibago pimira. Amanye first mothers and when I was the first mother when I went to hospital, so njena manyete so karongo de tembo pime nchai thought agu kunenda so that yamanyo mwana ga yago kayekire kumbe sio hivyo, nilikuja kujua baadaye namna hiyo. So karongo daktari yako tumeka those terms, it is medical terms na bere igo yani tubu atinsoni na benga buna riensoni taye karongo swati yakobina agu chikobyara usaga nyoro mwana na benga buna riria teba okorwara kabisa watwale riote mangana makong. So asa mangana yobo chano ni watu kwa ne bintu black and white bunabire egera mangana amanya koba burungi man pepesa gera wote banga daktari leo ni leo saro minto wacha daktari atue anataka daktari anaeleza vizuri bia mona sana daktari akatoka enderete wano tumurekera se kwende ya wasotara enda se department ya yokubita abantu ku make sure ngan kokoro bale operation ni successful to kwanere the achievements of nurses ngikeliyo korora mokora osebuna ya nurse keliyo korora wakodre and you thinking you feel good what abekirenga no kubweni montabu ene ose to hail okubwena ku monto to initiate okubwena ku morwaire some of the achievements even if you are asked today nga daktari wanega sia otigera kirera go home bolio kerogo orobo nyagitari, do you have something that you will go home with, work your head high? And of course my career ebina nyare ko bakingokora as Mariga.
I can start from the side of my colleagues. Nurses, wauguzi, we are doing our best. Like now, we see in a day around 1,000 patients. In these 1,000 patients, at least 1 or 2 dies due to a complication. 3/4 who come to the hospital, outpatient and the ward, they go home.
Yeah,
that's our happiness. As I said early, me I get excited. Like when a patient is serious and he picks or she picks, that is where I find my peace, my happiness.
Yeah.
The mortality rate reduces, has reduced.
Yeah. That is nice.
I have another thing, preventive. We do a lot of preventive.
Yes.
So when you realize like preventive is more than curative, the better. When you prevent and cure, treating is expensive.
It's expensive.
So nurses do a lot of preventive. MCH to give health education. Kwa nama kegusineka kongo kwa na advice kwena na obosemia buno mungina go chale nto mwana una competence ndani penda fana no matena ndo chojiche etariki ya mungina tare 10 to basa kueba very important.
Yes,
Mami, don't forget tare 10 at times when these matters divulge we have a way to follow them home.
How? Which way?
We have nowadays we have telephone numbers now. They read that book. Call them home. Mami, you didn't come for measles. Yeah.
Oh, you follow up.
Yes.
You know what is happening.
Yes.
Yes.
We give these matters nets. So they don't get malaria.
And where do you get your because you see a lot. You see a lot of good and bad things. Anything good. Condition pathetic. Where do you get your psychosocial support? Because I can be imagining your mental health.
We like in Kitiareche, where I come from, our CEO, Dr. Umeke Marita, has done 1 or 2 in terms of psychological support. We have a choir. There's another thing like chick-chack, people are dancing around the special clinic.
Yeah. But that's for patients?
No, for staffs.
Okay, for staffs.
We have a football club for people who want to do football. We have table tennis. Yeah. We have fitness clubs within the hospital.
At least you release your head
for the winning ones.
Okay.
Yeah. It just been started. Actually, that one's depicts that concentration after work. Yeah.
All right. Mbiamono sana. Ekitana ndenga nchiri kiagara igotolenche nae no muligereria. Ono bali bagotobwatya gwetera Facebook, gwetera YouTube, gwetera SMS. Nchiri ndaligereria subanga kuro kwa Honorable Fred Mapoa. Awata tukurwa suneka meza no wotseni bonja
no monjari no mata moroyo
Honorable Fred Mapoa. Asante sana. Deborah Nyangaresi nere na tukurwa igunga still is in constituency. Watu nyumbani wanakuangalia kweli. Barnabas Ratemuge Konge ya tukurwa diaspora Doha Qatar anasema Sara salimia mugeni sana. Asante sana na msalimia Mark Nyakina kurobo mwancha ekerubo onde me yomorovelio oyo ne kasediane Monkwanelie ni motegerete Nyakina. Thank you so much. So we suswera ngoro na Kuru City na watabatuletikorwa Michael Harris anasema watching Harrison well talking about nursing. Asante sana, anaitwa Michael Harris anyanomo manyete. Engineer Caleb koronya nturago ibeno egetongo watching you live oyunkoronya libali chache. Judy kudos Harrison Mariga. Judy thank you so much. Harrison Mariga gaki eti abange niko baguchanda na gote bangu tigando mugaka ukweli kabisa.
Yeah.
Nibachire leba peni eralia Harrison Mariga nikieko garananses bande bagusumbwa barwaire na ende nigo bakobarama nako batogonyera etibuna incheti na arengaro rekaro mwarenge go some finance bill. I think these are gone days.
Yeah, gone days. Those are past. Like I don't think now we're having it.
I don't think right now.
Yeah.
Oh, sorry. Whoever is calling Daktari will put it silent. I'm gonna go to Chokara meeting at Yangona Kagosenai. Gone are the days of nas go something that Mira about waited Jikare. No one to Tagete. Korakiango, na Rengoro. I don't think nowadays the same baro. You want to challenge you and the staffs and you need to do very quick because you don't know them. Jeria Kirvata ever listening Korangombo Manama anasema Wikankaso Wakisi County anasema sana salimia daktari. Musuluwesu anasema Harrison Mariga congratulations. Harrison Mariga ayena nchire no watu manyibweke rengo keigoro hongera. Asante sana. Musuluwesu amen. Tuateva amen. Nerateva amen. Ateva nurses congratulations. Liboli diane olia ugotoka moche ririndi. Ni nurse sama ni doctor? Nasema ule anapatikana moga. Ule ni nani?
Mocheri ndo ati nurse. Actually, that one reminds me. We were talking about what a nurse does up to last services. Actually, abantu baminto asema ngo tutagarra kurwa. Ekintu kiri tuweba. And I want to report on record, like Mapo Hospital. Nurses are doing well, including myself. I'm doing well.
Yeah.
Nurses have nursing homes. Mapo Hospital is the owner is a nursing home. The owner of that nursing home is a nurse.
Yeah.
The owner of Nyaka Chemist is a nurse. So, bantu baito mo toranga ba nga chasto chinas. We are organized.
Yeah.
Nurses are organized.
And you are learned people.
Yeah. When you find one or two nurses, when we are qualified and competent, because we have an accelerated way of training, the board of nursing. Like now, I can tell you for free, my number is 2,199. I have it over the head because I'm passionate. 23,1999. I have it here. Yeah. I want you to confirm this. I have it in my mind. Yeah.
Nurses by the way.
I have a practicing nurses.
Yes.
So these things, and this is for the county government.
Yes,
I have an MTAG. I'm not an impersonator.
Yes. Harrison Mariga. Yes. That's true.
We are organized. We are organized cadre.
Yeah.
When you find one or two nurses who have diverted, those are unfortunate scenarios. So that one does not make us. They never miss some side. Every market has a madman.
Yeah. Onye no yana bawakili kwa abantu ba practice yuko wakili ba kugira abantu bakaba kwibina batali qualified lawyers bakana na makosa.
Even market has a madman.
Yes, that's true. Sophie Motangi, at least now we have understood the role of nurses.
Very important.
Yes, sana Harrison Mariga abo tukina kora bwangu iga ngo kworoke basubate abangene ngo bagutaka abanyagitari abasacha babakonye ekero bakwibora nyagitari ngo bagote abanyagitari basubate ngo bagosumbwa na kubarama. By the way, women prefer male nurses to help them. Is that true?
I might not want to comment much, but what is important and what is fundamentally correct is such simple an attitude.
Yes.
You know, as I quoted earlier, almost about to chile. Okoire getabu kwali linga yari kuche clinic nuka ndiko mubolia maswali elimu ya kabere nga yari kuche clinic oligirira manyinga ena kiare onye tapi miro mutu mapi imwe mara ange ekero musubati agotomo musubati onde ebintu getatagete mara anga basubati especially basubati first time ladies they get irritated.
Yeah, sure.
Woman, you know they say unlike poles attract each other. Like Paul's people.
Yeah, sure.
It is, you know, in a society, complaints don't miss. But if in an unfortunate event we have such scenarios, those are few ones. So that one does not work, not deter.
And because, and by the way, it works with the trust.
Yeah.
Yes. Next time we got the work with
actually PR.
Yeah.
First impression very important.
Yeah, okay.
Yeah. You might find Amanas, a human being. The way I came from home in the morning, could be moody, and we have situations where, you know, when women are moody, which part of the month, so you don't expect the same way to handle a client. So this client also coming for my service should also be in my shoes. You need my service.
Yeah.
It's not about getting an attitude. Umenituma damu ni sawa, naenda wapi?
Enda pande. Yeah.
Akikumalizia kukutumia, kama umeona kufanya vizuri, mwambie Sara. Tafadhali sikufurahia lakini asante. So in that level now you have communicated. You know, someone who likes you, who loves you, tells you the truth.
That is it.
And I'm a truthful person. By the way, even in the workplace, I would want to be told my weakness and my strength. So I'm not someone like you can touch my knees and tell them no, don't touch. You know, at workplace we have what we call a resort of violence.
Okay.
So sometimes it's working across board.
Right.
And what's important here, our important person in healthcare provision is a patient.
Okay. Esther Merinho, this is your cousin. Anasema, congratulations my cousin Harrison. We are proud of you. You do incredible job. Esther M, that is your cousin. You bamwabo.
Bamwabo nyomire ali Mansai.
Kera garagara ali sibara.
Mansai Serinyo Sanale.
Oh,
Sanale is the husband. Anyomire Mansai.
Oh, yes sana. She is really watching. Daktari, when we come now asomo tutakero chikobaru takero chokoraki, what are some of the do's and the don'ts muruire abwenrete kokora onyo tebi unga no chogende theater kero to soete ga busete ya oboronge. Oh,
wonderful. That's now my part of specialty anesthesia. We have parameters to follow. When someone has been told you're wrong for surgery, it's not 1+1.
Yes.
We have to do what we call pre-anesthesia review. When we talk about pre-anesthesia review, we want to assess this patient, what he requires, what he does not have, what can we do to boost the requirement before we do surgery. We don't do surgery for the sake of it. You know, you do surgery to assist this patient. You don't go to theater to kill this patient, as I've said earlier, or do stop doing something you could have done so that the patient, the surgery becomes successful. One, if the HB of a patient is 8.8 and below, we will have to transfuse 2 units of blood, up to 3 units before we do surgery. Because during surgery, we bleed. See, we
cut.
Which one is Torusio Mwana? Punatuku Manyango Takare, on your mong, you know, Yamanga Taribuya, Totabaring clinic. That's the work of an anesthetist.
Yes, yes.
Warrior H. Moreiro, what was not what we get on your Kabata hypertension, Moagri, magnet like now PET, preeclampsia, hypertension very high, urine, you do urine for ketones, if the ketones is high, so you will manage this matter on beats before you do surgery. So our predecessor review is aimed at minimizing. Actually, the right word, you are optimizing this patient before surgery. So if we will not have the blood for this mother, we will not go for surgery. Unless if it's absolutely an emergency, we proceed. As we do the surgery, we transfuse, but have the blood. We may not want to stop to do surgery. We will proceed to surgery, but let us have enough blood to transfuse.
So you make sure that the patient is on
we assess Marambati. We look what we assess on the neck. We assess thyromental distance, which must be more than 7 centimeters. Preceding gene, which would imply difficult intubation. We check whether we have feet. So if this person does not have the front or teeth, we will do something to put that. Sorry, we can put it laryngoscope. So we optimize this patient. Ideally, the essence of pre-anesthesia review is to optimize the patient before surgery.
All right. Then why do you find it in Arende if you've done all those? Then we will operate her at 3 p.m. And you can do it now at 9 p.m. Why do you schedule?
No, we have what we call we have what we call emergency and urgent. So difference between emergency and urgency. Like emergency, if you don't proceed, you lose that patient. And urgency, it is not very urgent. It's not very urgent. So you can optimize this patient as you handle other emergency cases.
I get you.
Bleed. A problem airway. Airway immunity compromised. No, you're not a water sukari. We wish sukari akuraganya, we should nyaraganya ora konyo. That is why I talk to emergency list, elective list, and urgent list. Like now, TRH, we have 5 theaters. Every theater handles. Theater 1, we handle electives. Theater 2, surgical emergency. Theater 3, obsgai. Theater 4, Theater 4, orthopedics. Theater 5, orthopedics. After to go match.
Yeah. All right, that's nice. How do you make sure about Moruiro yo otuara that she will come out of that?
Pre-anesthesia review, when you do pre-anesthesia review, we talk with the patient. Actually, we create a rapport with the patient.
Okay.
Onye tabwatire na bekera ini. Kuna chichire ini chikubeka bila sana. Naone kana renge go soma within 6 months ina rekobeka ngobeka iga one touch. Pap. Na bekera ini. Na beka maji. Muroro ndubwanja ataraja surgery. Nkobonko yawara maji up to 1.5 liters.
Okay.
Because ile sinando kuchikobeka magongo ego chikoleta hypotension.
Okay.
Kono ikotora kono mosala. Because ego twara hypotension, we don't correct it, cardiac arrest. Yeah.
Wow.
Yeah.
Hiyo ni kazi ngumu sana daktari. Mnabeba tu maisha.
We love it. We love it. Najua when you do something you wanted to do, you deal with your
proper preparation. Ni kama ni mtihani mtu anaenda
for proper preparation. Yeah. Even consent signing. Yeah, like now the patient signs consent for the surgeon, the patient signs consent for my for anesthesia. Which says like munyagitari ko chwankorera upasuaji ye kende kense kekoba. Tinkubekera mu nyagitari magoso. Tinkubekera mu nyagitari magoso. Very important. Maybe agakane ari yabetonje bete basaini 1.7 ngija kuruzi. Yo ikarani bache bana ko tini bakore ya pick 1.7 ya nochi bwaza. Na nochi role boli jetingo chera bagango.
Oranyora omweno no moke. Tabwati bibuliro mwana banambali bagochorwa banambali bakonya bagochorwa para mwerere batagete bakore surgery for them to survive. Do you need again to time consent? Or so that one is a special case?
That's on such scenarios those are special cases. Okay. Actually even there is waiver. You know, when a patient says but needs surgery or needs care in a hospital, especially a public hospital, you proceed for care before we talk about money.
Okay.
Yeah.
It's for care first.
Yeah, care first.
Now what happens in there now? Before the even doctor comes, how do you make them comfortable in that room? A patient ninje.
Una nateba umurwere ninchende nere. Inchumu nyagitari omonene kujakara onda tujundo kumnyagitari omonene. Inchumu nyagitari omonene na abekire raini na abekira mache. Amariyo gari atakire na asabire. Omo system intondo ngeire na abekire pressure na abekire respiration dispute na abekire. Ekaron kolia resinga biri on korera kanina buya ngo tebie primary health care provider. In Kenya to work doctor, in the US they go to primary health care provider.
Do you have something like music in that room, or it's bored like that?
Ndo wate music on the veranda, but maybe now wona tu akwane ngo to mozio na ndikereti abaga cha kubeke music ya toka theater ndo beke ye veranda ye TV ye music ine no munya gitara cha kandoche achamente. Music therapy very important.
Yes.
Yeah. It's about resources. Yeah, it's about resources.
Thank you so much Daktari Harrison. My sweetheart anauliza hivi, is it true hii sindano ya family planning ni ya depo ni ya 3 months ina cause permanent infertility? Because you're here as a nurse.
It is what it comes, you know, family planning. It is individual, and those questions can be answered at the MCHFP level. Yes. We have what we call confidentiality. We have misgivings and myths about different family planning, and not all family planning methods they have their own side effects. Yeah, so that's just an allegation. But if she wants more information, you can come to the clinic.
Okay.
Any public facility or any private, you can be given the information.
It's open. All right. Munyagitari yunomuya nchina konye kire kibonko nyasa musesenie Sicilia kurabumo renda wo nya oro. Morenda bonyauro ero montonga musalute daktari kama na mapema anza sasa mapema. Asante sana daktari. There are some things that happen kwanyoranga ili hapenia theater. That's why you sign kwa matokeo yoyote yale. What happens kana kutawanya tokoluzi morwere you did your part as na nini daktari alifanya nini yake alafu they don't get out of that theater alive. Some few cases out of 100 maybe 99 iko sawa. That 1% ikonyarage guchikiaba so that mbongo bekerwa magoso nga moitiro moroiro ito, you know, whatever you get slapped ngani numu akoje. What happens? There's some patients who doesn't make out of the theater.
Edisori kwa mbuni nirigija lakini igentonda tebe ntara ngakinda kebeke gusi a disclaimer information is power.
Yes.
No ne Biblia nya sa tebete ngabantu bane basirire bakamaishibu maene. You know, knowledge is power. Wachiri na gitari. Ewa yani kwaru nyomba kwaberire mara manga abantu beto bakoberanka banyu jipanado baranyo mariogo batema binte bire gusi ebu ikasa sa tiza chabu tuko banyari ngaba go general nanda go general ali atagete yani buna ikaiga abantu bandi batene ni we urikerwe yagara ali serious. Fine, we have the protocol of triaging 36 patients to be fast. That process ameonekana tuseme ni surgery anapelekwa kwa juu. We have 3 designations about surgery. We have a patient who desperately needs this surgery for him to be alive. We have a patient like you do this surgery with or without surgery, this patient will not survive. But these people insist like sisi tunataka surgery. But you see now, it is the decision of the surgeon, the anesthetist who is me, to weigh the patient. Mara mingi huwa, like now, yes, I had a patient yesterday who had an accident, who had a microfacial injuries and the tibial fracture. For me to proceed to assess this patient for surgery, I requested for microfacial surgeon before proceed to repair tibial. So this patient has 2 injuries. So this one is affecting the airway, comes fast than this one. So the process of managing this patient on the microfacial complicates. We are not going to do this. So the patient goes. So these people who are from outside who are what we call knowledge in deficit. Anataka to, yani he wants you to be God. And I told you early, we treat God heals.
Yes, yeah.
Kwa nini atakuwa hai? That is the time that patient anakupatia a lot of pressure. Umpeleka haraka ndani. But when this patient dies now, he is the first one to slap you. We have what we call protocol to be followed before procedure is done. So if in unfortunate event that patient dies in theater, it's not always the fault of a surgeon or an anesthetist. We have done our best to many times you can do surgery, you finish and the patient does not wake up. After patients wake up to ICU where still another nurse will manage that patient in ICU. Imagine a patient who is not talking for 2 weeks. After the 2 weeks, the 3rd week, the patient has gone. Who do you blame here? But people are used to blame. You know. You know they say much is given, much is expected.
To whom much is given, much is expected. That's in
terms of nursing, as a fraternity, we have done our best. If you live here, I think you leave this station today, knowing we are seniors now. By the way, tell people now, these are important people. Now that you have information about us, tell people this is what we are. We were taught. See, I told you we went to try training, and we saw candles white that will protect life. That's what we subscribe. In that process of giving that care, the person has God. It is God who has made a decision. It's God who knows when you will die. The moment that man is na iko tapeta. Mara mingi huwa tunatupwa mawe sana. Na mimi sifurahi hivyo.
Yes, we blame you. Mgonjwa wetu ameenda hapa.
Abantu baide twabamanya ngaki akarumurira goje ndagitari kago chako nywe. Atumurwari. Kadi tomopo to treat. We treat, God heals.
God heals.
So when he
do your best.
Yes, when he does not survive or she does not survive, it's not a blame game.
Right. Then daktari, why is it that mgonjwa akishatoka pale kuna wenye wana make it out of theater, but after some time you realize the speech, hana speech, you realize ajielewi, after so many days. But I've
already said, like now we are doing craniotomy. Craniotomy ni ya kichwa.
Okay.
Kichwa inafunguliwa. We have what 2 cracks. A skull. That patient works to ICU. He stays there 1 month, 2 months. It was head injury. So in your own way, like head injury, see kichwa imegonga. You know the kichwa is connected to the spinal cord.
Yes.
So we have gone to theater to collect this person. But ideally, he will not see the cerebellum, kuna ile contusion kidogo.
Yes.
You don't expect that person to be normal. Atakuwa tu lakini kidogo tu huko kabisa. People should learn to accept, like after head surgery, in most cases some changes happen. That's the right word.
Of course, they cover the same person.
You know, when you realize, even in the Bible, when Jesus asked God, people wanted to stone an adulterous woman, he asked them, whoever has not done any sin, be the first person to throw
the stone.
The people who make crowds knows outside here concerning healthcare, that people are not informed. Koko ni oromo ndo tagete gwako mwana wo muntu lige na oromo omo nyagitari tabu ati mwana oromo nyagitari.
Yeah, that's it.
Noni gwete? Tabu ati mwana oromo nyagitari?
Na ni wanda yote ka.
No muntu lizuko gayo okonyora gari anyakarige na none pipiki tabu ati. None pipiki tabu ati. None nyange tabu ati.
Azokogorogwe.
Abantu baito igabanjira nenga ekorogo kinyagitari obo chacha kokon. Isa ko bebati embogende ne bati embe. These patients we sort out in the hospital. We don't know them.
Yeah, sure.
We are on duty to perform our duty on a shift.
Yeah, sure.
There's no patient who comes to the hospital that I'm waiting to see Sarah today. Like now I'm going to the hospital. I don't know my patients.
You meet them there.
I meet them there.
Yes. Okay. Then there are some cases, daktari, story. A surgery has been done. It has been conducted. Then kwa nyaranga nando oira nigu inge ndongere kiebet usina kabamba usina ganto kiebet winda. How does that happen?
That one is unfortunate. Those are unfortunate events because as I had said early, in theater we have what we call standard operating procedures. Before we do surgery, we have what we call sign out. Time out. You say the name of the patient, the age, the procedure, the part of the head, the procedure to be done. Let me now say on the stomach, like now CS. We have what we call ghost count, where we have a scrap nurse, a runner nurse, anesthetist, and the surgeon. The people who are supposed to do, we are supposed all to witness ghost counting.
Oh, you be 4 in that room?
We are 4 up to 6. We could have students. We have what we call ghost counting. Me on the side of the anesthesia, I'm supposed to take care of the machine and the patient, but I can witness ghost counting. So in most cases, because whatever we do in theater, ghost counting, we have what we used to wipe the patient. Is called ghost counts or ghost rolls. So I'm supposed to witness ghost counting. So like we have counted, like say we use 30. In another event, like we have another patient coming in for another emergency, you forget to recount, because if you counted those who are 30, if you don't count when you are finishing when you are closing the abdomen, you will forget, which is human.
Okay, so the rule is you count
when we counted 30 ghost rolls, before we close the abdomen, you're supposed to count. So in most cases, like we were so busy, I can forget to witness counting. The surgeon closed. Actually, the surgeon is supposed to want to lead, like before I close, can you confirm the ghost rolls?
Okay.
So it's not about the surgeon. Ni teamwork. Like if the surgeon is busy, amesahau kufunga the abdomen, unaambia daktari atuchakao ghost roll, or niulize kweli mmecount ghost roll. It's teamwork in theater.
Okay. I've seen.
So it's nakwanga few, which is unfortunate anyway.
It's very few cases.
Yeah, it's unfortunate. Nobody can just open that abdomen and intentionally leave that goes inside. It's unfortunate.
It's very unfortunate.
Yeah.
All right. Thanks for putting that clear.
Yeah.
Because
it's not intentional.
We come over. What am I just imaging? 1, 2, 3. Vitu mulitu.
Kuna wana hata ikane kalamu na sini. Ne diary ne bungo bya gari. Ikanga ne bintu byana byose.
We kwenda vyovyo sasa kwa. Acha Mariga tena Daktari Harrison Omwega Mariga na kwa libere masniktari ya Kisi Teaching and Referral under the leadership of Dr. Oimeke Marita, our friend sana that inkora chari maiga tuara gamba komo naenda kwenda maiga mange
ndo kenene ba Sara. Into East Africa, we are not celebrated. European countries, Australia, UK, USA, they're celebrating us. Actually, most nurses, every year nurses leave. So me, what I can simply tell our leaders, like now, nurses are doing a lot of exams now.
Yeah, sure.
If they don't embrace us by giving us more wages and improving the condition of living, by 20 what? This is 2027, 2030. We may not have nurses in, let me say, in Kenya. People are moving out.
They will be doing something different?
They will be moving out. They want to go where they're celebrated. You know, we want to work where we're celebrated.
Where you're recognized.
Not where to read. But like now, people drive big cars in the US and nurses.
And nurses. People who earn a lot of salaries.
Yes, I saw another nurse who was working in Minnesota. He has a very big hospital in Mombasa, and he has even apartments. Yeah. Nurses were organized. We are organized.
Sisi tumewa kidogo
amutuenzi. Tunaomba mutuenzi.
Madaktari wakuu, madaktari hawa tunawaenzi, tunawasherehekea na tunatuambua sana your efforts ya kufanya wagonjwa wanakuwa wazima. By the way, asmoka congratulations kabisa. Na leo bodi daktari how is technology changing the way nurses deliver care? Is technology changing the way you deliver your health care?
Technology is key because when a patient comes in for a visit, like he came in last year with the same condition, he had an inpatient number. So when he coming for a visit, when you enter the inpatient number or the name, you're able to see that patient. So you're able to see like, we give us the azithromycin for this patient, same condition, is not improving. So you change the regimen for that patient.
Right, and are you being trained to adapt to the innovations like telemedicine and electronic health records? Because evolve. You know, healthcare is evolving in so many ways.
Fine, it's evolving, but you see now what is key and where we are not getting it right, resources. Money for training. Resource mobilization, even employing more. You know, you cannot train the existing nurses on records. We don't have enough staff. On CMEs, you need resources. So with these mega resources, we are not moving in. But the systems are in place. What we need is like a booster on enhancing ICT integration in your system. It comes very easy when the systems are integrated. You don't have to do history afresh. So if you admitted Sarah, he has DM with hypertension. Is on Rosatan, where we change. So you are able to manage this patient without complications.
All right. Bia mwana sana Daktari Harrison. Omusoro anasema Harrison Mariga tiganya sago sesenye onyago konya abantu baitu na isanekire na maeleza ago kabisa. Yani yametosheka kabisa. Yani you really bring it out mpaka kila mtu ameelewa kwamba you really do a wonderful job. Robert Tom anasema applaud to that nurse. May God bless him. Robert Nyabuto from Nyakeri. Ondo Nyakitari omonende by the way. From today, amen. Nancy Kerumo Magore anasema kudos Harrison. Elisha Satande is a nurse. It's a big United States of America, by the way. Those who throw us stones are those who have no knowledge about it. We treat, but God.
Which state is he?
It's in Minnesota. Gitari nebirerieta ningesema hiyo hospitali. Felicia situkumbushe sahi hata on duty hata sahi usiku.
Tutaenda huko mwambie tunapanga kuja huko tutaenda.
Pia ni daktari amesema daktari ako on point. We work where we are celebrated. Na ndo likirevo.
Not tolerated.
We work where we are celebrated, appreciated and awarded handsomely. Ndio maana haturudi home. Amesema yeye atoki pale. Watching from Australia anaitwa Nancy Kerubo Makoli. They're
paid well. Actually, a nurse in the US is paid 1 million. Like me, I go to the US as a nurse anesthetist, I will get 1.5 million.
Wow.
we have not started. We have not started to think about going. But when some of us, like I'm a family man, the moment my kids finish school, we are going to live here.
Wow. By the way, Felicia anafanya ile hospitali inaitwa United. United what? Niambie Ben. United Children's Hospital. Oh, United Children's Hospital. No, Felicia Satande yako limiremo. Vivi, out of Kudos Harrison, we need to work where we are celebrated for sure. Yeah. Kila mtu anakubali. Felicia Satande amesema yes, United Hospital ndiye anafanya kazi pale. Saying Kipteng anasema Doc, kudos Doc, watching from KTRH. KTRH, hi.
KTRH, hi.
Hi cousins.
Hi colleagues.
Hi colleagues.
Yeah.
How are you? Thank you very much. Bagenda tukubatia umorobilio. How does nurses contribute to healthcare at the community level? Away from pale mahali mnafanyia kazi, pale mashinani, how do you contribute to make sure healthcare is provided?
We have a program like is done at very level.
Yes.
Nurses go, they have what to call out to the facility like beyond zero. They go to facilities. They put a tent somewhere. They offer some health care which are not very serious on acute illness. They do what we call the warming. They give nets. They go to barazas and give health education. Sensitization of the community about the need to come to the hospital, the need of gravity matters to come for care. Actually, what I can tell you about the Minto, almost what the car musigo, which clinic at least Maracane. Kawocha Maracane, Monas in Amateving, a pressure yao, we will ring a guitari, and then we will ring a guitari. Tigako and Habo, don't go Habo way. Come to the hospital, get care.
Okay. Gone are the days since I was what Naka.
Yeah. But still we have few elements that deliver at home.
Still labor in the Nako about mental well-being and what support systems are there in place to protect nurses' mental well-being. That no whatever CEO na atemete sana. But here is a case daktari. Kwa rule nyomba madam oko. Ada wakati ya wakana makongo.
Usikoro to koro to kiasiri kama.
Sasa socks ya bwana wakati nincho toko beka kama. Socks jitafutie bwana. Mimi niko busy hapa. Sasa umeenda na ile hasira yote pale. Unaenda kuwekea mgonjwa dawa. How do you differentiating now? I'm in my working place. Wacha niache stress zangu kwa gate. Lakini hata tuseme ati tuache stress kwa gate. It is not easy. You carry them mpaka na nomoro yote daktari na kina kwa yani yagonda hivyo. How do you balance now to bring out the best of you?
It is not easy.
Despite the challenges.
It is not easy. It needs a heart.
Yeah.
But now that the issue of psychological support, ideally, I said earlier, when people don't when they are not emotionally stable, they divert. There is no service delivery. When you're not emotionally stable, you can't deliver. So, like we have had few instances, like you have few nurses who are had colleagues who abuse drugs, but we don't have adequate psychological support. Maybe this one we can raise it. We have raised it before because these people are known. The people affected are known. But what sometimes when you might get a manager realizes you have a problem, he's interested about the patient, not you. That way we don't get it right.
Okay.
Yeah. See, I've told you there's a nurse who committed suicide.
Yeah, sure. Where you mentioned.
Yeah. So this guy was initially rehabilitated, so it's like as the managers, we didn't take an initiative to take care of the emotions. Now we were like reluctant. We have lost him. Very young, not married. Very young.
So they must come up with a program.
Rest in peace,
yeah. Sure, and it's painful to lose a young soul promising with a lot of knowledge of that. Yeah. So you
training a nurse in Kenya is very expensive.
It's very expensive.
Very expensive.
You thinking the program ne wena tago chaki kuna mwara agenda alia you easy.
Ama ndawe meet nenu tokonya support groups and NGOs, you can identify one. We will give you names. People need to be taken care of. These people need to be followed at home.
Yes.
Yeah.
Okay.
When you find someone over 30 years staying alone, he's not married, or was in marriage and they divorced, or she was married and she divorced, she needs psychological
counseling and care.
It's not easy. God created Adam and Eve. What was not wrong to create a man and a woman? He created first Adam. He realized Adam is not complete. He made Adam sleep. He took one of the ribs, created a woman. So God was not wrong. We can't discredit God.
Tom Robert anasema monthly salary of nurses please, as in big doctors. Anasema monthly salary of nurses please, as in big doctors. Inakuwa mingi because they are big doctors. Felicia Sotandi is watching with us very much. Thank you so much, brother. Anasema what incident daktari can recall when he offered his services and he came out happy na hawezi kusahau kabisa. There is a case, and you saying I live to celebrate it. Felicia, thank you.
I quote an incident. When I was working at Gonchari, that is 2014. I had a patient in labor. She delivered twins again.
Yes.
So there was PPH. By then we didn't have ambulance. We had to call. By then KTRH was level what? Level 5 or level 4.
Level 4.
So I had to transport the mother from the hospital with my clothes, with the two twins. The ambulance we carried the mother with was moving at high speed. You know, you are firing a mother, but the mother has to be in an IV line, transition normal. This lady has PPH. So I told my colleague, I have transported the mother to the hospital, carried the twins to the hospital. By the time I left KTRH, I was blood all over. So I handed over the mother to maternity, and the babies were taken to NBU. I stayed there until the mother was manning PPH. Some volunteers brought me close to where. I am happy about that. I told you earlier, when I had a patient who is serious, and when he or she picks, that's where I'm happy.
Wow.
That's where I'm happy.
That is big.
Yeah, that's why I celebrate.
Hiyo ni kubwa haki ya Mungu.
Yeah.
Ukanunuliwa nguo mpya.
I was happy like the mother is delivered, the mother is bleeding. Actually, I learned on controlling PPH, so I will never have another PPH now. I knew how to manage that PPH. I shouted for help, ensure we deliver the mother to the receiving facility. I was with the two twins.
Yes.
Yeah.
Wow, that's great.
Yeah.
Anyway, that's great, and no wonder you were called for this service. Lazima ukae daktari. Lazima ukae daktari. Lazima mwana atakobe musician utagetabe daktari. Anawe kanye gitari they don't care na barumo ruirengo kurare because it's not a calling. So tekero monto akore gentukeri anchite gukora. Agukora daktari na rote, but how is it important that continuous personal development in nursing? Is it very important for the continuous professional development in nursing?
What I can simply say in a nutshell, you need to grow. When you do more knowledge, service delivery increases.
Yeah.
And what I can tell my managers, when someone wants to add knowledge, let him or her be allowed.
Yeah.
So when you add knowledge, production increases.
Okay.
Because if you got a job 10 years ago, you have not done any professional development growth, then you are not moving right.
Yeah.
Because they say, it's like it's like
Yeah.
Yeah. You evolve.
Yeah.
When you add knowledge in this profession, you evolve to be a better person day in, day out, day in, and our experience also increases because you be handling different patients with different conditions. And you grow. Because
whatever you've known long time ago is not the same thing going forward. So it's very important for somebody to develop amangana training. Morning Etaya TV, thanks for hosting Daktari for consent, especially for critical ill patient and conscious with no identification documents and need emergency surgery. Then it should be done without formal consent to save life. Jacqueline. Thank you so much, Baba Jacqueline. Say a message ya Sara nje na arasire pe daktari okwana na mwana bagongoldre pe au tukobi ya sagramenda kulala sasa hivi. Daktari, mimi ni Evans kutoka Menyinkwa. Tulikosana na mtu, niko na high temper hadi mgongo inauma kwa uchungu, uti wa mgongo. Agaraga chiguno monto ajajajaja akor mgongo nkiatagira kore daktari najua once a doctor you're always a daktari. So any question wanajua is on the right hands.
Any question
is on the right hands.
Yeah, is in the right hands.
Adaviro mgongo ko moruma bwato abwate temperigo.
Kenya machari morero ndara retima have a bed rest. Yeah.
Bed rest na kunywa macha amuriro magana yomanya ko borongi. Happy naona happy unapiga simu lakini abo tulikire ujumbe asimambia bono. Daktari, what does the future look like in this nursing career or profession? Itakuwa mzuri zaidi.
You know, they say in English,
yeah.
You must create the future you want today. You create the future you want today. Nursing is a calling. Growth is optional. None tusibaba tabangi esabari amambie ko bangu rero uchaka rero iko konyoro moremba sigasi aho gukora ekero kunyanja.
Yes.
Na babarayi baito make our job easier by giving us enough resources.
Yes.
Motivate us by allowing trainings. Give us promotions. Give us timely salary and consistently.
Talimutinyo baba atala 27 next month baba atala 10. Hiyo tu ifanye ndio mtakuwa sawa. Because going forward tutageti muabeire examples enough. Tigaba ali babo cyo kusabira ubunyagita ali babo cyo gocha banyorenga at least you've made the way. Yani mumesacrifice. Let us be a reference book. Yes. Ochimoto mangana maiko boronge. Somebody wants to become a nurse. Inkiata keira kore kurbono iga. Somebody na robota garire already immediately, even me. Yes.
One, we have agreed you must have passionate compassionate for excellence and for humanity. You must have that heart, a big heart. Two, you must be very good in biology. You must be very good in actual maths and biology becomes compulsory, even chemistry and one language.
All right.
Because you need English to write medication.
Yes.
Because nurses do prescription, they do stitches, they do minor surgeries. It's major surgery we don't do. So ideally you need knowledge. You must be very good in biology, chemistry, English. No shortcut. No shortcut.
Chemistry, biology.
Yeah. Biology compulsory, chemistry compulsory, and biology. The three subjects compulsory. So English you talk about one language, either English or Kiswahili.
All right. Thank you so much, Robert. Tom, anasema I was forced to do education though I wanted to pursue nursing. Aliposiwa akitoa sasa wewe fundisha watoto wetu vizuri. Uchikote wana kwanza njiro unyita na target kwanza kwa sababu muliko hiyo. Atandi the degree holder anasema following, thank you so much. Felicia Satandi ako na sisi bado anasema adding knowledge plus experience expands your mind, don't stagnate where you started from. Yamono sana ni kundwa kwa nire ngambia komenta training na masomo. Atandi watching from Nairobi, thank you so much. Harrison Mariga okonyora muswati niga konyora bana akonyora murabuka osisinyaruka chiuka ono chire nyagitari onyolira umwana atakagirete kurwa nyomba nigatebirie onye naende gokonyora umwana tutatageti umanya nse inogucha osubati ogotebi Harrison Mariga nonchencheri umwana naki naki orojora kwanire nganeyo musubati nyolira bana amura bona akora nyitari musacho mutenga anya gogochera umwana mumura umanya home say no. Musubati chote ya daktari.
What I can simply say in a nutshell, I might not want to be harsh because I'm being watched worldwide. I can use a simple word, primitive. That man should be primitive, or that mother-in-law. If the mother-in-law wants a baby boy, that's a primitive mother-in-law. One, in chromosome amalgamation, a lady has XX, a man X. Why? So when you tell I'm the husband, unfortunately or fortunately, me I have 2 boys, 2 girls. If I want to tell you like I need a boy, it's me to give you a boy. So if you're getting girls, it is me who is giving you X. You're getting girls. So if you want boys. It is the
husband is the
determinant of which baby to get.
Wacha kusumbua
sisi. Hiyo ni
sisi we receive.
Hiyo watu wache hiyo kiere.
We receive is that.
You receive.
Yes. We are the donor.
You are the womb.
We are the group.
Yes.
Sisi tunawekelea.
Yes, we are the donors.
We are the store.
Yes.
Yeah.
So watu wache hiyo.
Julie the queen naona nalalamika hapa anasema, what about these other professionals like nutritionists? Are they not important in the hospital?
we are all important, yes. But the point we were discussing today is about a nurse being a backbone of healthcare. Kindly, don't misquote me. Yes. A nurse is a backbone of healthcare. All departments, a nurse is there. Yeah. You go in the airport. You go in the. Fortunately, I've had a flight to South Africa and Turkey. In that plane, there is a nurse. In KDF, we have a nurse. At the police, iko nurse. Everywhere. A nurse is everywhere. Even high school, a nurse is there. In the university, hapa mko na nurse. Congratulations. So, a nurse is everywhere. Actually, if you're a man and you have a nurse in the house, you have gold, treasure the gold.
Yes. Okay.
And if you are a man, you have a man, like now I'm gold where I come from. Yes. My wife embraces me. I'm gold. She tells me that, Daddy, you're an important person because he knows I'm gold. We are important.
Alright.
So wale mnazumbua manaza kwa nyumba kama wewe ni bwana, jua uko na kitu ya maana uvai kutupa.
Alright.
Treasure the nurses. Nurses are gold.
Naite Ngare ndiye anaingia saizi. Naite anasema salimia sana doc, mwambie hongera. Huyu ni kutoka Eldoret, ashaingia sasa hivi. Hakuwa na sisi hapo mwanzoni. Daktari, time is up and tunasema kilicho na mwanzo hakikosi kuwa na nini na mwisho wake. And we really very grateful to have hosted Daktari, and tunasema always there is next time. But meanwhile, you can give us your last final shot as far as yes.
Maybe what I can say in a nutshell, I'm proud of shit we Etaya, and I was here this morning to give to dispel some misconception about nursing. But I'm happy from where I sit. People are watching me. I do not now realize who is a nurse. A nurse is an important person in anyone's life. So what we are requesting, we want support from all departments to deliver. But the staffed mind cannot give care. So we want to have a health mind gives good care.
Yes.
So sisi tunapenda wagonjwa yetu. Wakati mgonjwa anakufa hata sisi tunalia. When we do last offices for our patient, actually it's the nurse, what I forgot, we are the people who do the last. Wakati mimi nimeingia tunawachunga. Wakati tunatoa mtoto tuko hapo. Theater tuko na nyinyi. Wakati tena amekufa, it is a nurse who is there, washes the patient, wipes the eyes. Actually we cry because we don't give care to lose. We cry. Yeah. So we're everywhere. We are only requesting humble environment to give care because it's a calling to be here. Lastly, yes, I'm a proud father of 2 boys, 2 girls.
Yes, congratulations.
My wife Drusilla is watching me. I'm proud of you. My son in Nairobi, I have a son in the University of Nairobi doing architecture.
What do you mean?
Yes, my son is doing architecture. He's graduating next year.
Okay.
The University of Nairobi.
You don't look like.
Yeah, my firstborn is 23 years old doing architecture at the University of Nairobi. Okay. My secondborn is Kenya High, Form 2. Who was in the US, they are going to Harvard to contest debate. They have come from Harvard last week. Yeah. I'm proud of Charity. Okay. I'm proud of my dad, retired Patrick Mariga. I was with him yesterday. He was not feeling well. I'm proud of Daddy. My mom is alive now, maybe Tutu Mariga. I have my cousin in the US, William Kiage, Minnesota. Yes. My uncle in New Jersey, Moses, Bati. I have another cousin in Maryland, Bosira, Mark Bosira is watching me. I have a good friend, Boaz, Smart Choice, watching me. Yeah. And I have a tutor, Kevin Mbote, who is coaching us on how we can do NCLEX and pass. Wow. From
you have so very big USA. Friends.
So what I can simply say, I know where I've come from, I know where I am, and I'm seeing where I'm going.
Right, that's nice.
So I'm finding pleasure all my way because I have a clean heart to move. Thank you so much.
Thank you so much, Daktari. That is powerful parting shot. Meanwhile, Joshua Tandi Kireki amesema Salimia Harrison, tell him nursing is a calling. I talked with him in the morning. Yeah, he's a good nurse. My advice, students going to KMTC, choose nursing because with Kenya nursing, you can even practice abroad. Yeah. Final but not least, kwa Dafin Elshi anasema I'm impressed with your presentation my colleague, I salute you. Anaitwa Elsheba. Thank you very very much. Na walitu watigiri siko tunasema tunashukuru sana daktari. Thanks for your time. Thanks for your
I'm also happy to come here.
Thank you.
So 2032, when I will come here to contest governors in Gizi County, you will tell people this guy is equal to the task. Yeah. I will contest.
Thank you so much. Those are good and valid dreams. Yeah. And panaponjia panania pananjia. Kuna Kiswahili inasema hivyo. Yeah. Thank you so much Munyagitari Omanene okwenda Nyagitari ali Karua Mariga Mango Chase CEO Karua Mariga Mango Chase Munyagitari bonsi bari batumanyete wacho muri tukorera abo asebono otoringa na Daktari Harrison Omwega Mariga korwa alisuneka konda korega sia Nyagitari ya KTRH tokwendera mange igoro yega sia Munyagitari chinas twaroringa na kibale very powerful na kibara abantu bengencho ase obogima kero mwananchi asekero bugima bwa kero monto ngana ubagutara na barabwa tigatokorega naende toba masikani tobasike ogana Nyagitari kwanere biya na baroba kwanere biya egera magana manyeko baboronge ikachinga kichinde naende asomoro biro kwita breakfast show utokubatira na mzee wa kazi Brighton Makoli oyosuka kidogo kongali baga korasanga na Daktari Mariga Franklin Mayunga na rulenga sensemo ye camera chinga kven moriango alenga sensemo ya transmission nje tingana Etaya Breakfast show Sara Nyarangi Ontita nayo mwanchu murigereria pia mona ya bene asogotuma chujumbe asogosanga nainte tatokorega na ndiri tukolia ankyo Etaya TV oborabo bwagusi. Thank you so much.
Thank you.
TV oburabu bwagusi
ine nuganite gucaka gose kugariyo butugi bwecingoko engoko company ni gobo bwate gucakira ibicucu by'ibirengo by'igoro mono byiri tukelimo ebyo byire chanjo bitari gocandwa n'amarwaire broilers echo kigo kina bwango gweke kilo nenusu asa matuke 30 layers kikobeka magena gweka 330 aso mwaka amagena yokoria are fresh emesaro ya improved kienyeji buna saso broilers na rainbow roasters cyose aso kubeka magena boigo enyama nechitwa nigo chigwisalera konyenya asemetienyi itatuyuka na gweka chikiro gwetani ibere nenusu asemetienyi tato boigo mabuhati bichuchu bya improved kienyeji byomotenyo yomo amonendagira ao jechingoko n'ibintu by'ugucirageria buna feeders na drinkers asamange batarira bisichabo imeyomo cy'obusongo mwa Mutumbi Plaza mbarabara na main stage yechigali gose bakiresime ase namba 0710831806 gose website ya www.engoko.com engoko amonaye asobotuge nuganize konyore mashini yekerero yo gosona cyanga gose bya Kigali bono